Hi friends, welcome back to the Blueprint Nursing YouTube channel. My name is Abby, I'm a registered nurse here at Blueprint, and today we'll be jumping into the world of pediatrics by reviewing growth milestones. If you have children or know a little bit about them, I'm sure you've noticed how rapidly they grow and change. And this rapid growth means a lot of major skill development in a short amount of time. Let's take a look at some of the most important growth milestones. There are many areas of growth experienced throughout infancy and childhood, and a few we'll be looking at today include physical, cognitive, social, and emotional development. Physical milestones that are considered key milestones for an infant include holding their head steady by 3 months, rolling over and sitting up without support by 6 months, pulling up onto furniture by 9 months, and standing unassisted and beginning to walk by 12 months. Cognitive milestones for infants include recognizing familiar faces and voices by 3 months, beginning to understand object permanence by 6 months. Hello, peekaboo. That's one reason why infants love peekaboo, because until this skill is developed, they think you disappear when you cover their eyes and reappear when you uncover their eyes. It's also a big reason why infants can be so sad when their caregivers leave the room, because they don't yet understand that even though their caregiver has left the room, they still exist outside of the room. By 9 months, children begin to problem solve and reach for toys outside of their reach. By 12 months, they'll begin copying sounds and gestures and using first words such as mama and dada. Socially and emotionally, we'd anticipate infants to be smiling and cooing in response to their caregiver by 3 months, showing expression through laugh or facial expression by 6 months. Stranger danger starts to appear by 9 months, while also enjoying interacting in games such as peekaboo. By 12 months, children have developed a strong attachment to their primary caregiver and will show a wide range of emotions, including excitement, happiness, frustration, and sadness. Why are milestones important? When you're working as a real deal registered nurse, part of your job may include providing education about child development and growth milestones. So why should caregivers and parents know about them? Growth milestones help evaluate if a baby is growing and developing properly. If there are concerns about developmental milestones, this allows for interventions such as physical or speech therapy to be implemented early. Tracking these milestones and educating caregivers and parents on them helps involve them in their child's care and helps them best support their child. One thing to keep in mind is that every child develops at their own pace. It can be normal for some infants, especially those born prematurely, to reach certain milestones at different rates than their peers. It's also important to remind caregivers to keep their appointments. This helps everyone to stay up to date on the child's progress and ensure they're receiving everything they need for their best development. A real quick memory tool. This trick helps to remember gross motor development during the first year of life and goes from head to toe. 4 months is head, holding their head upright. 6 months is trunk, sitting up unassisted, and 12 months is feet, walking while holding onto furniture. These are the references I used. Thanks so much for reviewing growth milestones with me today. I hope you found this helpful. If you have any questions or other topics you'd like to discuss, leave a comment. Be sure to check out our other social media platforms, including our TikTok, Instagram, and our website for all your NCLEX prep needs. See you next time.